Welcome to Nursing Competitors. Question number 1. A pregnant client comes to the office for her first prenatal examination at 10 weeks. She has been pregnant twice before. The first delivery produced a viable baby girl at 39 weeks 3 years ago. The second pregnancy produced a viable baby boy at 36 weeks 2 years ago. Both children are living and well. Using the GTPAL system to record her first obstetrical history, the nurse should record A. 32002, B. 22022, C. 31102, D. 21102. Answer is Gravida 3, term 1, preterm 1, abortion 0 and lab 2. C. 31102. Rational. The client is currently pregnant for the third time, that is Gravida 3. Her first pregnancy ended at term 39 weeks, term 1. Her second pregnancy ended preterm 36 weeks, preterm 1. She has no history of abortion, A equals 0. She has 2 living children, live 2. So, score is Gravida 3, term 1, preterm 1, abortion 0, live 2. Second question. A client admitted to the hospital for an induction of labor owing to a gestation of 42 weeks confirmed by dates and ultrasound. When she is dilated 3 cm, she has a contraction of 70 seconds. She is receiving oxytocin. The nurse first intervention should be to A. Check FHR, D. Notify the attending physician, C. Turn off the IV oxytocin, D. Prepare for the delivery because the client is probably in transition phase. Answer C. Turn off the oxytocin. Rational. The standard of care for a induction according to guidelines that contraction should not exceed 60 seconds in an induction. Induction should stimulate normal labor. 70-second contraction during the latent phase 3 cm or not the normal. The next contraction be longer and increased risk to the mother and fetus. So, IV oxytocin should be turned off is a priority of action. Next question. Question number 3. Which of the following step is not included in surgical safety checklist? A. Time in, B. Time out, C. Sign in, D. Sign out. Answer is time in. Rational. According to WHO surgical safety checklist, trick sign in, time out, sign out. Sign in. The period begins before induction of anesthesia. This space should be assessed between nurse and anesthetic. Time out. The period begins after induction of anesthesia and before skin incision. This space should be assessed between nurse, anesthetist, and surgeon. Ensure antibiotic prophylaxis. Ensure antibiotic prophylaxis has been given priority. Fourth question. All of the following are correct about WHO 5 hand hygiene movement except A. After touching the patient. B. Before touching the patient. Before touching a patient surrounding. D. Before do any procedure. Answer. Before touching the patient surrounding. Rational. WHO 5 movement for hand washing. Movement 1 before touching a patient. Movement 2 before a clean aseptic procedure. Movement 3 after a procedure or body fluid exposure risk. Movement 4 after touching a patient. Movement 5 after touching patient surroundings. Next question. Question number 6. What is the position to keep a 12-year-old child after lumbar puncture to assess CSF? A. Semi-fowlers, so that the child can watch TV and be entertained. B. Prone position for several hours so as to prevent a headache. C. Unhair right side to prevent leak of CSF. D. Prone for 2 hours, prevent headache. Answer B. Prone position for several hours so as to prevent a headache. Rational. Recommended position in lumbar puncture. During procedure, lateral recommended position or C-shaped position near edge of the bed. First choice. Sitting position and the patient sit on bed, leaning on cardiac table, feet supported on a flat surface. Post procedure. Prevent post lumbar puncture. Prevent lost lumbar puncture, headache by a place. The client is prone position for 2 hours. After that, place the client in side lying or flat position for 2 to 3 hours. Then, after head bend, the bed should not be elevated. Thank you for watching. Click to subscribe and like.